Story 1. Colic is the bane of my pediatric specialty. Does your child cry uncontrollably for hours on end? Well, do not shake your baby. Good luck. Story 2. How the brain deals with damage is complex. We cannot give recovery times or predict outcomes because we do not know. The brain is remarkably resilient and fragile at the same time. Story 3. I was once in the hospital about to be sedated. I casually asked how anesthesia works, and the anesthetist replied that we do not actually know how, only that it does. Story 4. Autoimmune conditions. I used to think it was straightforward. Then I was diagnosed with a disorder. Everything is hit and miss and open to interpretation, even blood work. I went from seropositive to seronegative at one point. How? Do antibodies, rheumatoid factor, and antinuclear antibodies, ANA, disappear? Or do they fluctuate? It depends on the rheumatologist you ask. Symptoms overlap with many conditions and treatments work differently for different people. Sometimes they work for a while, then stop. You might have systemic lupus erythematosus or arthritis, but it can be hard to be sure, so doctors may prescribe an antimalarial medication and ask you to report mouth sores, liver changes, or lack of effect. It could be the medication or a disease flare. Autoimmune disease can affect parts of your body you did not know were linked. Your reaction to gluten and dairy may change. Which came first, depression or inflammation? No clear answer, and more medications may follow. If you are hypermobile, consider Ehlers-Danlos syndrome or postural orthostatic tachycardia syndrome, POTS. Fatigue. Story 5. Researchers are not completely sure what initiates labor. We understand how it progresses, but the initial trigger is not fully known. A popular theory is that secretions from the fetal lungs signal the placenta to start labor. Story 6. How placebo medications have made a significant difference in disease treatment. Story 7. There is still no single, concrete scientific model of consciousness. The brain is a network of neurons that send electrical signals to one another, like a complex computer. We can observe brain activity through functional magnetic resonance imaging scans. We can even identify which parts of the brain are active when we feel happiness or sadness or when we recognize a face. But we do not know how electrical and chemical activity gives rise to subjective, first-person experiences such as seeing the color red, feeling heat, or having a sense of self. This is what philosophers call the hard problem of consciousness. We are becoming very good at imitating brain functions with artificial intelligence, but we have not begun to reproduce subjective experience. It remains the greatest remaining mystery. Story 8. I am not a doctor, but I recently underwent cancer treatment. One medication I took stimulates white blood cell production, but a common side effect is bone pain. Antihistamines work very well to relieve the pain, and the reason is not known. Story 9. The immune system is its own unpredictable thing. My son is recovering from Guillain-Barré syndrome, and what I have learned is that the immune system sometimes behaves unpredictably for reasons we do not know. We can only hope it calms down before it damages something important. It is very unsettling. Story 10. How we lose accommodation, our ability to read small print, is not fully understood. There are many theories but no concrete explanation. The lens continues to grow throughout life and becomes more biconvex, which should increase the eye's focusing power, but it does not. The ciliary muscle remains functional well into the 9th decade of life, and the lens zonules remain attached and functional throughout life. The cause is likely a combination of these changes, but there is no single definitive explanation. That is why if you ask 10 different eye doctors why people lose the ability to read small print, you may receive 10 different answers. Story 11. Amyotrophic lateral sclerosis is a progressive, ultimately fatal neurological disease with no cure, no effective treatment, and no known single cause. Life expectancy after diagnosis is typically 2 to 5 years. Diagnosis is often made by ruling out other conditions. The disease causes gradual degeneration and loss of motor neurons, leading to progressive muscle weakness and paralysis. It may involve autoimmune processes, but the exact mechanisms are not fully understood. Common names include Lou Gehrig's disease and motor neuron disease. Story 12. When I was choosing a major in college, I had many discussions with professors that essentially boiled down to this. A doctor never truly understands how to fix a patient's problem or even why a drug works, while an engineer can reasonably expect to resolve a machine's root problem because there is a logic to how things work or do not work. I chose engineering and stayed in it for 40 years. No regrets. Story 13. We do not know exactly why we need sleep or how it works. We have a general sense but cannot explain more than that the brain needs it. Story 14. The microbiota, whose dysfunction may underlie some functional disorders, could explain conditions such as irritable bowel syndrome. People with irritable bowel syndrome experience symptoms despite having normal gastrointestinal investigations. There is no conventionally identifiable structural problem. Increasingly, irritable bowel syndrome is thought to result from a disordered microbiota, a poorly understood state. The microbiota also appears linked to the brain and mind, which may account for the frequent co-occurrence of irritable bowel syndrome with psychiatric conditions such as anxiety and depression. Story 15. Much of it is only partially explained. Engineering-minded people often come into the hospital expecting the body to be predictable. If there is a problem, you simply find the bug and fix it. Show me the data and I can do it myself. They become disappointed when symptoms, laboratory values, and imaging do not correlate one-to-one. When medications have side effects that are sometimes worse than the problems they are meant to solve. And when replacing one organ does not fix other failing organs, even when the damage began with the first organ. The idea that humans and their body parts have a lifespan is intuitively understood yet difficult for many to accept. In short, there is more we do not know than know about how it all works. That is why funding for science and high-quality research is important. Story 16. Most issues related to pregnancy are complex. Pathologies like eclampsia are not well understood. Babies can also be quite unpredictable. Story 17. We understand that anesthesia is effective, but we do not fully understand why. Story 18. I am not a doctor, but I have not been able to get an answer for why we yawn or why it can be contagious. Story 19. How acetaminophen works. For the record, I am not in any way discussing autism. Story 20. Why do identical twins occur when the embryo splits at the beginning of pregnancy? Story 21. Are women sentient and capable of feeling pain? I feel like I know, but many doctors do not seem to. Story 22. The mechanism of the photic sneeze reflex. Why some people sneeze when they go out into bright light. Story 23. I'm not a doctor, but I would really like to know what on earth dreams are and why we have them. What is the point of them? Dreams are completely fascinating. I am far from an expert on the human body, but I would still like to know why I have a movie theater in my brain only when I sleep. Also, what on earth is the house I keep dreaming about? I have never lived there, none of my friends have lived there, and I do not recognize it at all. Story 24. The question of what exactly causes birth to start is unknown. Story 25. Frozen shoulder affects mainly middle-aged people and people with diabetes, but the reason is not fully understood. Story 26. As of my last review, the question of why we cry has not been fully answered. The effects of lithium as a mood stabilizer are also not completely understood. Story 27. It becomes interesting when you combine two areas we do not fully understand, such as women's health and attention deficit hyperactivity disorder, and bring questions about them to your doctor. Story 28. Just the brain. Our understanding of how the brain leads to us is laughably weak. Story 29. Endometriosis is severely under-researched, and there is no known cause for why it develops. It is extremely painful to live with and affects more than just bad periods. My endometriosis would trigger my sciatic nerve and cause major weakness in my legs, to the point that I began using a cane daily before I had a hysterectomy. Story 30. The human body is so incredibly complicated that it's a miracle it's able to function at all. Story 31. I am an anesthesiologist, and we do not really know the mechanisms of action of many anesthetic agents. Story 32. How do we know someone is staring at us? There are no wires or noise, only a psychic feeling. We often even identify the direction correctly. Story 33. The common denominator for many of the deepest mysteries seems to be the hard problem of consciousness, namely what fundamentally allows for first-person subjective experience, also called qualia. Our current scientific models are rooted in physicalism, also called materialism, and they do a fantastic job explaining brain function and behavior. We still cannot reconcile subjective experience with a purely physicalist third-person explanation. This same gap appears in other areas, such as the placebo effect. We can map out some mechanisms, such as expectation-driven release of endogenous opioids and dopamine, but the power of belief and context to trigger profound, measurable physiological healing remains a staggering mystery. It highlights how little we understand the fundamental connection between mind and body. Story 34. Epilepsy and seizures. Most people do not realize this, but in about 60 to 70% of epilepsy cases, doctors cannot find a clear cause. It is not that a cause does not exist. Current tests cannot detect it yet. Epilepsy can result from many different causes, including genetics, brain injury, and infections, but for most patients it is labeled as having an unknown cause, or as idiopathic. In some cases, it may be attributed to stress. There is still much to learn about what happens beneath the surface. Story 35. Scientists have yet to discover how neural networks create self-consciousness, let alone how the human brain processes two-dimensional retinal images into the three-dimensional phenomenon known as perception. Story 36. I do not think we will ever fully understand the human mind. Story 37. Perhaps the most fundamental mystery is what consciousness is. Story 38. I have been in trauma therapy for several years. My therapist and I have discussed that much about mental illness remains unknown. A lot of treatment is trial and error. I have done a great deal of eye movement desensitization and reprocessing work, and when I once asked how it works, he replied that clinicians do not know the mechanism. They have observed the results and know that it helps. There is so much uncertainty. Do I have borderline personality disorder because of childhood abuse, because I was born with it, or both? Is it even a real disorder? Some researchers argue it does not exist, and others suggest that adults diagnosed with borderline personality disorder may be autistic people who did not receive appropriate support in childhood. We also do not fully understand schizophrenia, and new studies suggest more subtypes than previously recognized. We can scan people's brains and observe physical correlates of mental illness, but we still do not fully grasp what those differences mean. People diagnosed with borderline personality disorder often show an overactive amygdala and an underactive prefrontal cortex, yet we cannot pinpoint a single way to address those findings. Story 39. This is a funny question because the common treatment for most ailments and injuries is to clean the wound and let the body heal. We cannot even replace destroyed tissue without the body overreacting and attacking it. If you lose your ability to clot, to seal wounds, or to fight infections on your own, you are in serious trouble because we have limited means to help. Story 40. I am not a doctor, but isn't fibromyalgia just a term for unexplained pain when the cause is unknown? Irritable bowel syndrome is a general term for unexplained digestive tract problems. Story 41. I would love to meet a doctor who knows how to cure tinnitus. Story 42. I am a massage therapist and I have one. Do you know those spots that hurt when pressed? If you press and hold them, the pain sometimes goes away and sometimes it does not. We do not know why. We do not even know what those areas of pain are. Story 43. I am going to say this as a patient. Idiopathic intracranial hypertension is a rare, incurable condition that I and many others suffer from. Science still does not understand what causes it most of the time. I have an unusual presentation compared with other patients, and my condition is somewhat treatment resistant. Because of my unusual presentation, the medical team is not sure what to do, since I do not meet the traditional criteria for surgical intervention. Story 44. Endometriosis. I decided to learn about endometriosis and am sharing what I found. I do not guarantee accuracy. Endometriosis occurs when tissue similar to the lining of the uterus grows in other organs. The cause is not well understood. It can behave similarly to cancer in that tissue spreads and invades nearby structures. There are no established biomarkers and some genetic abnormalities have been identified. It is likely related to immune tolerance, hormones, and genetics. There have been only 3 or 4 clinical trials in the United States that I am aware of, despite the condition affecting about 10% of women. Functional medicine approaches include bioidentical progesterone, supporting liver detoxification with compounds such as diindolylmethane and sulforaphane, and use of aspirin as a nonsteroidal anti-inflammatory drug. These measures may help for some people. Conventional approaches include hormonal contraceptives to control symptoms or surgical removal of the uterus in severe cases, when appropriate and acceptable to the patient. In the future, there may be biomarker-based pharmaceutical treatments, possibly adapted from breast cancer research or immunomodulatory therapies. Endometriosis can cause pieces of uterine-like tissue throughout the abdomen that can bleed, causing severe pain and inflammation. Story 45. This is obscure, but I deal with it. Kennedy disease is almost always associated with androgen insensitivity syndrome. Individuals with mild androgen insensitivity syndrome are most likely to develop it. It is the first test they run. Its cause is unknown, and there is no treatment available. An affected person may have it for decades and usually dies at a normal age. Most insurers exclude coverage once the diagnosis is made. Some neurologists avoid making the diagnosis. Story 46. Each disabling medical condition I have is poorly understood, and treatment options are limited. Story 47. From what I have heard, we know surprisingly little about a woman's libido and how to increase it. Honestly, how is that not a priority? Story 48. Why electroconvulsive therapy is effective and helpful for people with bipolar disorder and major depressive disorder. Story 49. I am not a doctor, but I am a licensed massage therapist. What are knots and how do they function? I graduated in 2006. My teachers said they did not know. 19 years later, we have done a few studies, but we still do not know. Knot sensations can cross the central nervous system, which should not be possible. They are impervious to Botox injections and lithotripsy. The only thing that appears to work is static pressure sustained for 20 to 30 seconds. Story 50. Deja vu. Oh, and consciousness. How did you end up in that body? Story 51. Anesthesia encompasses many effects. We can explain which receptors drugs act on and what the clinical effects are. However, how each drug affects the global function of neuronal networks, and how these drugs might alter those networks in the short and long term, remains unknown. Story 52. I spent the last 2 months researching to write a grant and hopefully secure funding for my research project on endometrial diseases. Story 53. Chronic pain is not fully understood. There are many models and theories, but no definitive scientific explanation for why some people develop chronic pain. Story 54. Menopause is overlooked because the medical profession has long dismissed women's issues and experiences. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.